me today. And I'd also like to welcome several guests that we have in the audience who have normal name tags as opposed to these magnet name tags. Please introduce yourself when you get a chance at the break. At SVP, we've been spending a fair amount of the year educating ourselves about our own internal resources and capabilities, and we're also now embarking on an effort to just make sure we understand all the initiatives going on in the community and all the activities. And there's so much happening, and it's hard to keep up. So this is, I don't know if it's the first, but it's the first of several opportunities we have for educational sessions for ourselves. And we're really pleased to have Angela Antinori and Susan Rothschild here today. I won't attempt to give their backgrounds. They've got great backgrounds. We should have bios in front of you. And so we're hoping to learn about the initiatives that these two are working on along with others. And I'm sure there'll be an opportunity we will make an opportunity for questions and answers at the end. So without further ado, let me turn it over to you two.
Great. We're going to focus on the topic of homelessness today. And please, if you have questions along the way, feel free to ask them and let us know. And Angela and I are going to share information back and forth. I work for the county, so I have an official role in the county, and Angela is independent and involved with many nonprofits. As many of you know, homelessness has been an ongoing issue in our community for many years. It's nothing new. There are at least 10 county departments, many nonprofits, and numerous volunteers who work with this population. I would just tell you it affects the jail, the sheriff's department, probation, alcohol, drug, mental health, social services, public health, community services. It goes on and on. Lots of departments have little pieces. And I think little pieces is one of the challenges in this whole function. Many people think about homeless and they may think about one type of population. Maybe think about mentally ill individuals, maybe think of people with drug or substance abuse problems. But it's really very diverse and very different. So there are different types of people in the communities we're talking about that experience homelessness. Thus, there's not one answer or one way to address it. I did want to share with you, this is an area a lot of people have been struggling with a long time, but we know we're not effective. The outcomes are not what we want to see. I have a handout at the back that talks about homeless services provided by Santa Barbara County departments. This is an 18-page spreadsheet that shows different departments and the funding they have that goes into it. Some of it is very targeted, very requirement-based funding criteria, but it's not working. So I think one of the things we can say right up front is that there are a lot of people doing a lot of things, but we're not achieving the outcomes we hope to achieve. If you have any questions about this, feel free to ask me. You'll see there's a lot of overlap and a lot of attempts to coordinate, but again, we're not seeing the outcomes I think we want to see. Questions about that? So there is, I think, growing consensus in the community here locally, nationally, and even broader that we really want to see a system that works, and housing first is one of the best ways of going. Different communities have seen that as a successful model. That is not looking at addressing problems and saying, okay, when you clean up your act, when you get a job, when you're substance free, then you get housing. No, housing first and services first, and then looking at the other services seems to be an effective mode and strategy used by many. So that's just kind of a basic introduction to some of the issues we're talking about. Angela's going to talk a little about why we think this is a particularly good time in our community to look at the issue of homelessness.
So as many of you probably heard and know about, the fiscal situation, not only in the public sector but for nonprofits, is an interesting opportunity. It creates a really hardy crisis, and I think there's enough heat being generated by that it creates an opportunity for change. And so some of the parties that have been working for a really long time are at a point of dissatisfaction, like as Susan mentioned, with what's not been happening, that they're ready for change. And so the momentum and the environment to create some changes in the systems delivery or the philosophy and the approach to be able to come more collaboratively together is perfect. There have been also, in addition to the current kind of economic realities, there's also been some changes in partners. So many of you may have have heard, or some of you may have heard about the crisis regarding some of the properties and the services delivery in Longhook. So the county and others partnered with many people, funders and others, to create some changes in how those service delivery model is put into place. I happened to go there yesterday to see how that was happening. There's also the small business community. There's opportunities with, say for example, in South County, the Downtown Association, in North County, other businesses, and looking at how they can support some of the issues going on. Some of the nonprofit leaders are feeling a real pressure to change what's happening. There have even been changes in some staff. Some staff, whether they're county departments or in the nonprofits, because of the generational change of people sort of aging out, if you will, when you're going into retirement, there's also some new blood and some new energy in the organization. So again, a really nice time for change. Another thing that's happened just recently and that has been building up is that the elected officials, at least on a county level and here in South County in Santa Barbara, whether you're on the left or the right, conservative, liberal, libertarian, whatever, it doesn't matter, people are getting behind this. There seems to be some attention because of how much it's costing and what outcomes we're not seeing. And so the political will is also there. Another external factor that's having an impact on homelessness is the AB 109 realignment, the prison realignment system. And again, there are dozens of case studies. We can get into detail if you care to later at another date. But basically, the criminalization of homelessness is very, very expensive. And so looking at a housing first or housing ready model is something that is cost effective as well as will require a lot of business model change. So we're trying to impart and support the various entities involved with this, everywhere from the electeds through to the decision makers and the people who have resource allocation authority, to strategically approach this question of managing homelessness from a different perspective and a different angle. Take what's been working in certain areas, amplify it, and then de-accelerate or actually norm out for what hasn't been effective. So we're really looking at strategic organizational effectiveness sorts of approaches. I mentioned, we talked about there are some new partners. One of the challenges is that people have been entrenched in how they've been thinking about the issues. Some of the activists have had very loud voices. They've been sort of on the edges. And I think what's happened now is people have gotten an interest in issues for the variety of reasons that we've talked about. It's been hard to move some of the personalities to come together, but there seems to be there's people in the room I know that have a little bit of background in this, but there seems to be momentum. As Susan mentioned, there are many, many county departments and nonprofits involved with this, and the one thing that's very clear is there's not one entity, one decision maker, one funder that can deal with this issue or this complex set of issues by themselves. There's no one that's going to be effective on their own. It's going to take a very cohesive, strategic approach to try to actually manage this for cost effectiveness as well as getting people off the streets and having the humane approach to how we want to deal with this.
I guess I want to share a couple things that are going on. I'm not sure how much you know about this, so stop me if this is already known to you. Basically, the Board of Supervisors has approved a study of our alcohol, drug, and mental health agency from top to bottom. So they've put out an RFP, and at least 10 entities have responded to study how our mental health agency and system works, both for inpatient, outpatient, as well as organizationally. So that's an important thing that's going to be happening in the next couple of months, and they'll report back to the board in August. When that was brought forward to the Board of Supervisors, one of the supervisors said, I want you to study the possibility of moving the mental health agency and the public health agency into one larger agency. Because if you think about health, you think about the whole person. Well, this is one of the issues we think about with homeless because they are clearly very much served in both those agencies to a high degree. We've worked closely in the last number of months and recent years to do better across board, but I'll tell you, historically, there was not a good relationship in terms of for the patient. But a patient could go see public health physician and get medication and get treatment, and they can go see someone through alcohol, drug, and mental health and get other medication, and they're not be knowledge about what that patient was getting and what was happening. So looking at the whole, something we've worked to improve dramatically. We have now a better referral system. We have more coordination. But I say to you, that's the backdrop. Part of that is prompted by fiscal issues. Can we save money and efficiency? And part of that, quite honestly, is prompted by, can we do a better job of serving people that we serve, the most needy and low income? And the homeless are clearly a big population that's served by both. I would also just support something that Angela said. I don't see a lead agency in the county that's taking ownership. And that's for a variety of reasons. It's complex, it's not easy. Many of you may know Ken Williams. He was kind of a point person who worked for the Department of Social Services. He's retired, and they're kind of deciding how to fill that role, what to do. His job was officially as an eligibility worker, which is identify people who are eligible for state and federal benefits, but certainly played a different role in our community. So I think that we have these things going on in the background that make this a unique time for us in the role of serving low-income and homeless population.
Many of the prongs, the way I kind of look at this, if I were going to draw a diagram, is that we've got the housing, shelter, treatment folks doing their stuff. We've got the community action groups, faith community, business people doing some of their things. We've got the resource allocation process kind of as the hub in the middle. And then we have policy issues. And so some of what is happening throughout the county is looking at what are the best practices nationwide. Not only here what might work in our little Santa Barbara or our county of Santa Barbara, but what are some of the proven best practices that provide us data about those things. And so some of the materials that we sent to you, I wanted to acknowledge Rob Pearson for providing some kind of just verification and validation for us. That the Seattle programs, for example, are in some ways what we might want to be when we grow up here, is an expression that was said to me. And in looking at how they manage incorporating all kinds of different looks, as you mentioned, the diversity of what the homeless look like. One of the things also happening is there's, again, the political will. Steve Lavarino, the 5th District Supervisor of the Santa Maria, is coordinating and hosting a veteran stand-down at the beginning of October. There was every entity, there were 60 people in that room yesterday when he had the planning meeting, and he personally is engaged in trying to involve the various entities all the way through to how are we going to support the animals being transported with the vets so that they can have their companions with them. So the angles of this, so the families, the single moms, the single folks out on the streets, the diversity in that population requires multiple responses. That's the other thing, is this is a really sort of interesting problem, an interesting question, because it's not a one-size-fits-all answer. There's going to be different things that are required depending on the circumstance. And as Susan mentioned, the multiply diagnosed with physical health, mental health, and other kinds of issues require multiple responses. Our coordinated efforts on any issue require us to be smart, or allow us to be smart. And I think there's been this sort of scattered approach that's sort of, I hate using military analogies, but buckshot. And it's only going to maybe hit part of the targets. And so we're trying to have a more coordinated and intelligent effort. And I think that the tone is ready for that.
So there was one of the handouts in the back, if you had a chance to pick it up. It talks about searching out solutions and some recommendations about approaches in addressing this problem. I want to point that out to you.
Now, this is actually based out of a federal study that talks about how what we're doing is connected into a national sort of approach and support.
I also want to mention, I don't know how many of you saw the homeless death review report and homeless death process that's happening on an annual basis. So the process is looking at every homeless person who died during the year and gathering data about those people and saying, what can we learn from that? We can learn that the average age of death of people homeless in our community is 52. And traditionally in our community, we call any death before the age of 78 premature. That gives you some balance. The percentage of individuals and homeless who have alcohol, drug, and mental health issues is over 80%. The next most common cause of death is cardiovascular, chronic health issues. So these are people who have issues, both physical health and mental health issues. So those are just other ways of looking at that. we want to open it up to you to be able to ask questions. And we want you to help us think about what would be ways you think that social ventures might be able to be engaged in this process. But first, do you have any other questions for us? Yes, please.
In terms of what's being done in the country, you know, when I was working with the feds and the state and so forth, everything was categorical. Everything was funded categorically. And that was the biggest barrier that we ever encountered to try to bring services, integrate services. What's the farthest model that's, and how big is it in what geographical area in which they have actually combined state, local, county, anything into an integrated service system that would be truly what we're shooting for?
There are various pockets around the country that you have to address different kinds of needs. If you're in a very urban area like Los Angeles,
Yeah.
Supervisor Zarowski, I'm sorry I said his name incorrectly, Zarowski, has supported getting the 50 top most kind of challenging, difficult, vulnerable folks off the street. And it has required a multidisciplinary approach and looking beyond the traditional funding lines. For example, Seattle looks at it from a slightly different perspective. They do things like they'll have an advisory group of people who are homeless that advise their process. They even create resources through their overall approach for all kinds of nonprofits, not only those servicing homeless. So it rather depends on the dynamics.
I would share with you, my experience is that the federal funding is as categorical as it's been.
Yeah.
That doesn't change too much. What we do have in Santa Barbara is we have human services funding from the county level, human services funding from city. We have opportunities to blend that, but they're separate processes at this point. They are not integrated. And I think that is an opportunity that we do not maximize.
But the furthest we've gotten is Seattle, which has kind of an advisory panel that really integrate. Because clearly what needs to be done is you're presenting it. And as I think everybody realizes, you need a completely integrated system. And just the closest anybody's gotten to that, sorry,
That's okay. Actually, there are multiple examples. I think what I was trying to communicate was there's Seattle, there's LA, there's Denver, there's Cincinnati.
But in terms of the funding component.
Or in terms of fully integrating the system, the closest we've gotten is Seattle, which has an advisory group.
I wouldn't want to say that Seattle is the closest thing. I'm sorry, I may have misspoken a little bit. I was using the example of an advisory group of consumers themselves, the clients. Other areas are also doing that. These programs that are successful around the country are doing that across their different ways of dealing with the diverse population. So they almost all of them have some sort of advisory.
I don't know, I personally do not know of the example that would be said, this is the most integrated model.
Thank you.
Is there any, 30 years ago to help the geriatric population, we created vehicles like social HMOs that allowed combining federal funds, Medicare, Medicaid, state funds. Is there anything like that either in existence or in process for the homeless? Because that was specifically built to get around for the geriatric population, all of these bureaucratic barriers. And it seems appropriate now to talk about considering that in some of the homelessness, where you would have a local agency, public agency, or nonprofit that had their hands on the pool of things, and then within it could allocate, independent of sort of the categorical rules.
I recognize, and I want to make sure you know, I have a limit of my knowledge in this area. I'm not an expert in homelessness. But most of what I'm seeing in terms of the federal funding is very categorical. So for instance, the public health department, we have health care for the homeless program. It's very specific about what we do within the health care for the homeless program. And so those folks do that work. They go and do the shelters, they do it in other places, but they're separate from the people who get the housing. Rob can speak about that. And we have done some collaboration locally, so our public health department is working with community services to help fund the mortgage shelters, for which there's no categorical funding that we want to join together on, and we coordinate. But I would say it's a limited basis. I don't know, Rob, do you have any more information about that?
The other community, San Francisco, even though they still have a homeless issue, their public health and mental health is in the same department. That department's gone so far as to create housing for homeless because they can more effectively serve them in housing that they control. But San Francisco is also a city-county government together, which has helped deal with issues like this. But that's one.
The question that you raise is an interesting one because it requires us to think about what's the policy, what are the silos, and how do we implement most effectively.
Has anyone done a real scan of comparable communities on a national basis to surface the models that have developed at either the county or the city? Or we've done that actual comprehensive look?
That is underway as we speak. There's the people who come together to try to look at this from a more collaborative approach, and that's exactly what's happening. There are people in our community, in the county, who do have exposure and opportunities to be part of a national network. Some of them have more information to bring to bear, and we're, like I just mentioned, people are in the process of trying to do that analysis right now and take a look at the hardcore best practices.
Do you need funding for that?
Absolutely. The funding that I think one of the things that's fascinating about what's happened is that funders are actually looking at that collaboration process as requiring an investment. And so in order for this to be done smartly, it would require a community, I think, to invest in that effectively.
Is there an actual proposal being developed?
There are some people who've come together informally that are in the midst of providing, I don't know how granular, I'm trying to stay like high level best I can, and I want to answer your questions, but I'm tempted to go like way down in the details. I would say that yes, there's likely to be in the very near future an entity that would want to apply for support.
I would say that as someone rather new to the community, I found there are a lot of people who've been working with this issue for many years, in many realms, and devoted themselves, but they've been doing it how they've been doing it. Doing it with the same population in the same way. They know each other, they go to the same meetings, they see each other in different places, and they're good people. But I think this is an opportunity to look at it differently. And I think they do need some outside help and assessment and some real look at best practices at this opportune time to really break out. I think you raised a good point. Yes?
I'd suggest if you're going to look at other communities, you look at Dane County in Wisconsin, which encompasses Madison. They've had a wonderful homeless program that's integrated with their mental health programs and other programs for a long time.
Thank you, Iris.
Yes.
I think you said that you sense that the various elements within the community are anxious to work on homelessness. Are they coming to you and saying, let's collaborate? They are. And so what do you think the catalyst is to make this happen?
As I mentioned, there's several prongs. As I mentioned earlier, the economic situation, the heat is on, the pressure's on. Not only is it on from the service provision perspective, but the number of people needing supportive services is increased. The face of that person is broader, wider of those people. You know, like I mentioned, families that are on the risk of being homeless or are living in multiple family, 2 apartments with 7 families and things like that. And people don't necessarily see that in Santa Barbara County, but it exists in very clear, increasing numbers. The whole idea of the cost of housing, if we're looking at a housing first or housing ready model, there are more and more people that are faced with that loan. And so from a funding perspective for the service providers, they've got pressure on them to do more with less at the same time that the population is increasing.
And I do not think that the whole idea of collaboration is something people are really not for. I don't think there's defensiveness. I think these people have worked well together. I think they want to do what's best. Part of me, and I'm more of an outsider, I've not been as involved, I'm not sure they know what to do next. Honestly, I think they're involved, they're invested, they work well together, they go to lots of meetings, they talk about things, they look at the category, but I think we need a game changer here.
And do you have any idea what that might be? Well, I guess that's what I was asking.
For those of you that don't know me, my name is Rob Pearson. I'm the director of the City Housing Authority here in Santa Barbara. One of the big game changers was our administration of a vulnerability index that we took from physician, Mr. Collins, Dr. Collins out of Boston, and we administered that last February, a year ago, countywide, where we did 3 days of going out and surveying the homeless and actually establishing a vulnerability index. Who is most vulnerable to die on our streets? Those are the ones we want to focus on getting into housing. Well, since we got the data collected and put it into a format that's usable, as of last May, we've housed approximately 60 people off of that list that were major consumers of health care. We're in and out of the jail system, in and out of the court system. So we are making some headway. And our housing authority also stepped up to begin building the Housing First model. So we're into our 3rd new construction project. It's on Lower Bath Street across from the athletic club. It's now framed. We've gotten into this in a fairly significant way as a housing authority. A lot of housing authorities across the country have avoided dealing with homelessness because it is a messy population to work with, and their needs are so great, and we have so many other poor people on our waiting list, from seniors to developmentally disabled to low-income families. But how do we call ourselves housing authorities if we don't get involved on homelessness? So we've stepped up, but we've been very concerned that the support system for these folks, once we get them into housing, has not been solid. We've been made promises about funding, and that's not come forward. So we are working on the game change, and we've engaged Angela as our facilitator to try to do this. And I assume we spend a little bit of time on the new model that we've come up with.
We can't. It's kind of like I'm being asked to provide. We'll see how
Okay.
much detail we need to get into. But yes, I have information about it.
But nationally, the Housing First model has finally gotten traction. I mean, we've had homelessness come about because of the loss of a lot of our SRO hotels in many communities through downtown redevelopment. That population used to live in those Skid Row hotels. Redevelopment across this country has wiped those out. We have not built them back. The mental health system in California has been falling apart for years. When we decided to close the mental institutions, we were going to build back community-based housing. We haven't done it, much like a lot of other states. So now the pressure is on to do it. I just came back from a conference in New Orleans, the first Housing First conference in the nation, and we had some very good examples, and we're beginning to share them at the national level. Pathways out of New York has been perhaps the most progressive in creating housing. Santa Barbara signed on to the 100,000 Homes campaign, which is a campaign to get our 100,000 most vulnerable people in this nation into housing. The woman, Becky Canis, who ran the program out of New York, was really responsible for cleaning up Times Square. Times Square for years had 50 to 100 people that lived in Times Square, and they were very visible, vocal. They fixed that. We want to now kind of import some of their concepts and methods for doing that to Santa Barbara. And we are now one of the 100,000 home campaign communities because Santa Barbara has long been recognized as having a homeless situation that is not acceptable. So,
So in the back, you've been wanting to ask a question.
Yeah, I'm very interested in veterans, and what is, I have a lot of questions, and I don't want to take up anybody's time. Is there somebody, can I just email you, or? Okay. But what I really, first of all, I just want to ask, what is being done to coordinate with veterans groups, or is there anything being done? Is it all still very separate?
Yesterday's meeting with, hosted by Lavalino as the countywide effort was very impressive. There was everybody there from probation to the public defender to the VA to public health, mental health, all kinds of nonprofits, the Red Cross, the Veterans Administration across counties, not just in Santa Barbara County, but San Luis Obispo County, and there were representatives from LA veterans. There were housing, health, other health-related entities, the shelters like Good Samaritan and Casa Esperanza, both north-south here. It truly is a countywide initiative to look at getting these people access to some information and some choices. Benefits was there, looking at social services, all kinds
So
of
this
things.
stand down is scheduled for October?
Yes.
This is specific date
Yes.
and activity specifically for veterans?
I can get you, you can contact Steve Lavalino's office, or I'm happy to make a link for you as well.
Thank you.
the one thing on veterans is we have been funding through HUD these things called VASH vouchers, which are Section 8 vouchers for housing, strictly for veterans, but they kind of give, referrals come through your local VA office, and Santa Barbara County Housing Authority has about 100 of these vouchers, and it's the one program that Congress has seen fit to actually add money to the HUD budget, and we should pick up, I think, if the president's budget proposal does ever see the light of day for next year, we should pick up probably another 50,000 dash vouchers nationwide. But there is a recognition that folks really do need housing, and a separate allocation of Section 8 housing vouchers needs to happen, and that's finally being rolled out.
At the same time, Suzanne, the military is increasingly trying to deny that there are military-related mental health issues.
Right, that's a whole different.
And so that, well, these types of, adding Section 8 vouchers is great. We're actually cutting back very deliberately at a national level on mental health benefits for veterans, which is going to produce a tremendous problem over the next 5 years in this country.
They're going to fall through the cracks, a lot of those folks. That's what I'm trying to understand. I mean, they're falling through now, but it's going to be even worse.
They're going to be a lot.
There's a large number.
Right, huge, huge number. So that's what I'm trying to understand. How do we deal with that?
What is the reason for it?
It's to me, it seems like it's a denial of responsibility. Okay? This has been true since the 2001. I mean, we have systematically, across a whole range of things, cut back on post-service support for our veterans, particularly in terms of medical care. It's been terrible across the country, and some of the most egregious stuff, like what's happening in Walter Reed, has been stopped. It's still very poor. And mental health, they are increasingly instructing military physicians to indicate that people have pre-existing personality disorders, and therefore are not responsible after the discharge for the post-traumatic stress. And we're seeing a recreation of the same factors and the same psychiatric problems on a huge scale that we did in Vietnam. This time we know from the prior experience what's going on, but we're even less responsive than we were post-Vietnam.
When you start to understand the funding dynamics of all this too, it's very hydraulic. Like a cut one place hits a bigger cut someplace else, or the funding that, say, a vet can receive for a certain period of time, say in detox, is different than a single mom who's pregnant, or has a baby or something. So that's why I'm hoping we impart to you the complexities and the very different, the diversity in the population of who's homeless and the types of things that we have the opportunity to look at differently. Yeah.
No, I don't know whether it's changed, but as of a year ago, CASA still couldn't use 100 of their beds, except in emergencies after the 31st. And one of the things, and New Beginnings, I know, was having trouble finding places for their overnight parking. It seems to me that one of the things we need to talk about are where problems bureaucratic barriers could be eliminated without any additional significant funding. Are there things in front of us where we have, is it still true, they've got 100 beds that can't be used?
In fact, I'm leaving shortly to do a cost estimate on the board meeting, the board item, so we can figure out how we're going to close the $300,000 budget shortfall between now and July 1. Because we're really on the ropes. Things are so far off on donations, and I could spend a couple hours here. It's really sad how much this economy has dropped off giving to issues like this. So, and CASA, while we do have the capacity for the 100 beds, we'd like to open them. I'm not sure the funding to support our ability to open those beds exists.
I mean, because that doesn't require new construction all the time, all the
But
time.
it does require employees.
Yeah,
Yes.
we do need to get the funding up. And
Shelters require employees, but there are
at least they're existing 100
they're
beds.
existing, there are things we can tackle, there were church groups willing to help, and the first year we ran into problems with fire marshals, and there are a lot of things that are much more cost effective where government could solve the problems instead of create them without very large substantial additional dollars. And just like earlier, your most vulnerable people, I think some work on, tackling those barriers would be high on our consideration.
And we need the political support generated as well, because the reason we're not at 200 beds year-round is the neighborhood where Process Grounds is located. There is a feeling that you open more beds, you draw more people to the community, and if the shelter existed in your neighborhood, you probably have some issues. We're doing our best to try to resolve them, and we don't think it's a big impact, but we need political support and fiscal support as well.
Can I ask a question with this housing first? I learned when we were at Goleta that, Goleta Valley, how few of the people that were still in the low-income housing were actually low-income people. I think it was like 8 out of 100 or 50 or 60. So when you do housing first for these people, they own that housing unless they move out forever, right? No matter what happens.
No, we've been depending on if we can get them into employment. In the same, you're talking about a privately owned. Most of the government housing, like that's owned by a housing authority, we keep raising their rent so that they get pushed out because they could rent in the open market for what we're charging them. That doesn't happen in the
And when you put a new person in, they go back to the lower rent?
They go back to the lower rent, and you try to advance them through family self-sufficiency programs, employment and training. So we've been successful on our housing first about moving people up and out. Now, those that have a mental disability that's long-term, and they're not going to be able to be employed, we will be with them. They'll be with us for a long time.
I thought Angela would quickly show a little bit about what the model that's being developed here and the collaboration that she's facilitating.
Lori, did you want to ask something first?
Just a quick question on the Housing First model. I know there's a lot of effort put into new facilities, and you're on the Bath Street facility, and Paul is raising this issue of existing facilities that have capacity and would require new construction. Is there also a look at increasing the density on some of the existing facilities? And I don't mean beyond a reasonable level, but some of them are very...
Low density? We're looking at all of our properties right now to have density. The planning commission has been open to that. We're also looking at the Pathways model in New York is for housing authorities and nonprofit community to master lease existing apartments and use it so you avoid the capital cost. You can subsidize it with Section 8. But we need to make sure the services are funded before we go down this road much further, and that's what this collaboration is about. I don't want to go down that road as an agency without guarantees of the necessary support services. Otherwise, we're housing people, evicting them a month later.
Right. So for example, in some of the projects that are approved, you don't want to double up on occupancy until you know that the support services are in line.
Right.
Okay.
And most of the units we're building now, we're talking 250 to 350 square feet. So we are getting good density.
Right.
We find the model works best with one person per unit.
I'm talking about, the ones that have 600-800 square feet. Yeah. Okay.
And then there are I just visited 6 facilities yesterday, because this is not, homelessness is not the background through which I come to this. It's the facilitation and process piece, and I've done a lot with for-profit, nonprofit, and government sectors, and so trying to look at, looking at Peter, thinking about Strive and Thrive, and some of the processes and the business approaches that have been done in the community to provide sustainable long-term change. We don't want just a carrot stick kind of thing on this. We want to be able to look at the internal kind of motivation and momentum from multiple perspectives. And so in looking at the multiple units, I saw houses with 5 bedrooms with 2 mothers with kids in each bedroom. So, it depends, we have to look at it, but there were supportive services available. So you have to look at what is the question, what's the problem, what's the issue that needs to be solved, and have the models be responsive to those. The other thing I would say is that we need to build something that's agile and adaptable, because those realities change. Some of the properties that were built 20 years ago maybe were for, a family with 8 people in it, and now we're looking at, however many square foot units for singles. So we have to be able to look at how to solve some of these issues with the possibility of multiple responses. So you'll notice here, I'm not going to show you every slide, I'll just show you a couple, but I think it's important to highlight, it's the restructuring of the Bringing Our Community Home, which is the 10-year plan to end chronic homelessness, Common Ground that led with over 500 volunteers, the vulnerability index that Rob was mentioning, and then what are called the SHACs, or the HACs, and the community action groups, the homeless advisory committees. So I just want to let you know that there is momentum. People are wanting to see some change. And it's real important. There would be people in the community who would really want me to say this to you, that this is an influx, move, in motion model. Okay, the communication is meant, those arrows are meant to demonstrate that the communication needs to be taking place across the groups. What's being proposed and being supported by many of the local public officials, the mayor here in South County, several of the boards and supervisors, is a leadership council specifically to deal with and respond to policy change that would need to happen. So if something's happening at the local level that it would require some sort of initiative, policy change, allocation, or what do I want to say, accountability issue, they would be responsive to that. There's conversations taking place behind the scenes. We're probably going to be going before the Board of Supervisors sometime, I'm guessing, beginning of June and of May. The coordination committee that has just met to sort of start to think about, the proposed group has met to start to think about those executives in the various organizations and entities that have decision-making authority, formal authority over resource allocation, and that includes staff. What are they going to do? How can they do their work differently? So when you have alcohol, drug, mental health services, public health, people like Rob, others who are coming together and saying, oh, and the sheriff's department with the jail, probation, parole, those kinds of groups, how can those groups hear from all of the spokes of the wheel to be able to understand how they need to bring to bear the changes in order to be effective? So we've got the housing, shelter, treatment folks who are meeting. There's, again, distinction in North and South. A component for data and evaluation using things like what's provided by the vulnerability index, and looking at the other things that are available, like what data do we have about veterans? What data do we have out of the public health department's homeless programs? What data do we have about from the nonprofits that are tracking things? And looking at that tracking system. You know, how are we going to know if we've got one target or two targets? What are the outcomes we're really aiming for? The various goals that are going to get there. How do we know what's working and not working? We can't, I don't think, as a community, answer that question right now. That's what gets me, kind of gets my juices flowing, is how can we start to answer some of those questions? The community action groups include a lot of different groups, including the consumers themselves, faith communities, others who, like maybe small business owners who want to bring to bear or bring up to the group, the overall system, some of the issues and concerns they have. I recently was speaking with someone here in South County from the Downtown Association about how they can have a conduit of communication to the coordination committee. What that's going to require is some, as Peter was saying, is staffing of that. And we're looking at what are the various functions of the staff in order to hold these groups kind of in their net, in their web together. That those people, whether it's a homeless coordinator or a coordinator and then maybe someone like me who helps to facilitate some administrative support, not to provide direct services. This is not to try to get into the business that all these other groups are already doing, but rather how can we look at the best practices, do the analysis, look at data systems that are going to work, make sure that those entities are done smartly so that it's really that we're running a business effectively on this. So let me leave it like that. And, yeah.
Are business people in that coordination committee? You going to do business leaders?
Here's an interesting question. I used to own small businesses here in downtown. That group, remember, is executives who have resource allocation authority and accountability for staff and services. We want to make sure that through the various entities, especially here, that the business community does have input and access to this system.
How about assets?
Pardon?
How about the ability to raise funds among the business community?
Absolutely, absolutely. And the leadership council as well. I mean, these people need to be, the accountability of the overall system has to have some objectivity. And that's also why we're not suggesting that this be housed in an existing nonprofit or government agency that provides the services. It's got to be smartly, uniquely, like almost dispassionate. It's got to be very rational in terms of how it's approached.
What you're talking about creating are the two elements, the leadership council and the coordination committee. There are housing shelter treatment groups that currently meet, but we're looking at refining how it is that they do communicate between and amongst each other and the community action groups. How can these people be talking the same thing so we're solving the same problem? So there are some things that exist there. I think there's enhancement in the business approach through this piece here. I mean, when I was speaking to some of the business owners, because I was involved with business myself and I'm self-employed, so what is my job? Why would I go to those meetings? And so we're trying to wrap our heads around those things, and we're getting input from people all over the place. Yes?
I understand what the housing, shelter, and treatment folks are. The community action groups, is that this group? Or is this, who are the community action?
The community action groups are made up of all kinds of different groups. Like, for example, people that volunteer to provide meals, or the learning centers that that help staff the learning centers, all those kinds of things.
There's the Clergy and Laity United Group. There's a lot of them that want to work on homeless issues, and they put pressure on the system to try to do a better job of it. This coordinating committee is going to be key. It's going to create a forum.
That's not good.
Okay.
It wasn't me.
Figure it out.
Someone was calling.
The coordinating committee is hopefully going to, we don't want to make it any larger than 18, we're hoping 12 to maybe 15, to include the county department heads, the public health director, social services director, mental health director, myself as a housing authority director. We don't meet on a regular basis to resolve the issues that my staff brings to me, telling me what's wrong with mental health in this instance. And it's kind of a repeat scenario that I hear from my staff. So I would like the opportunity, with the sheriff included there too, to say, hey guys, let's figure this out. This isn't your part of the system is not working. What resources do you have to solve this, etc. So we've talked about including business at this level, but as Angela pointed out, we're not sure what role it would be, because unless they wanted to help fund certain things.
They want a voice, and they want to be able to bring issues forward. And so we're still formulating this. And that's what's been quite interesting, is that to be responsive to, not one person or entity has all the smarts, right? And there's this group of people that has come together and tried to really receive the ideas and information and have it go both ways, so that it's not a patriarchal, you will make it be this way, because that's not going to create the change we need to see.
It seems like maybe there's, I don't know which box it fits in or its own box, but it seems like it's almost an impact group, meaning other people that are impacted by this, right? Which is where the business owner would fall, or the community who's concerned about where the shelter's going. Right. A residential person could show up.
This is really a diverse, multi-pronged kind of piece, and to actually say the link, here's an example of the link. It was through the community action groups on the ground that we did the vulnerability index that fed this. So that's the example of wanting to make sure that information is going, in all different directions.
That's a big, sorry, go ahead. I was going to say that community action group is has a major, huge scope.
We have affectionately referred to the staff of this, however many or not the people are going to be, as cat herders, because they're going to be like trying to really herd the cats. Just like the population is diverse that we're dealing with, so is this. And an example of a department or a function that Rob didn't mention was, on here we even have courts with commissioners that are going to be involved with this, because what they decide to make the legal decisions about, if they have restorative justice and restorative policing to link into, then their response is going to be very different, and the use of the jail and prison system is going to be different. The hospitals are also involved in that. I mean, how many ER visits and what kinds of health care gets consumed has a huge financial impact. So it's very interesting. I don't know very many issues or entities or kind of approaches that are going to encompass all these different entities. Yeah.
Angela, I'm reflecting on all of this and certainly learning as well. And I'm thinking about barriers to change, and we've talked a fair amount about some of those, focused funding and a number of issues that have kind of make it difficult to enact this kind of integrated change, right? And Susan mentioned that there are a lot of well-intentioned people who have done the same thing for a long period of time. And hopefully decisions or discussions going forward will be informed by data and best practices and so forth. But at the end of the day, there has to be some mechanism to resolve conflict, right? So does that happen at the coordination committee or a leadership council, or how does that get moved forward?
Good question. One of the things that I'm so fascinated by is that when you work in a for-profit entity, and I do a lot of work right now, for example, with Amgen, okay, so I'm traveling all over literally the world for them, and then I'm dealing with the public sector. The public sector funding process is designed to be difficult. I mean, when you are the stewards of public dollars, it's designed to be challenging because that stewardship requires a coming together and a looking at problems from a different way. So it's very different cultures. The culture of what's trying to be established here, I don't know quite, let's see what we can do. Update later would be good, don't you think? There we go. The culture that's being created here is going to require all the entities to think differently. Because we want to be able to look at what works from a for-profit model as well as that public model, and there are clashes. You can't just push on this part and expect this part to go down. When you push on this part in the public sector, this part goes up. It's very hydraulic. And like, for example, funding. How long can funding be used to house someone in detox? Is it 7 days? Is it 14 days? If they're a vet, it's 21. If they're a single mom from South County who has to go to Wampo because we don't have that down here, it's 14. What? I mean, there are those kinds of questions, but there are rules and regulations that we don't have the control over, as someone mentioned earlier. So, yes, when we met just this week with the kind of pilot group of the coordination committee, one of the things we talked about, and I think people's heads were full, was what is the decision-making culture going to be? And that's why I believe the facilitation of this, the staffing of this, is going to require dealing with some pretty messy issues. And it's going to take time. The thing that I'm really encouraged by in the public sector aspects of this is we just saw a unanimous vote on the Board of Supervisors to support looking at mental health recidivism issues in a different way. They're going to have to be dealing with AB 109. We've got the city of Santa Barbara who's unanimously put some support toward the coordination of this. So back to Peter's question, I mean, this is going to require time and an investment in creating the culture and the decision-making process.
The report that went to the Board of Supervisors in response to a grand jury report that basically said, you know, why are we having so many mentally ill in the jail? Is that very cost effective? That report shows that the minimum is 25% more expensive to keep them in jail and recycling. And yet we talk about building a new jail at a significant capital cost. We talk about its cost $15 million a year to run. And yet the report says that the jail is our largest mental health institution in the county. And so there's got to be a way to take that money and put it into supportive housing. But as we said, the categorical funding issues, the way public money is, you know, would the sheriff give up a new deputy in order for me to build some supportive housing or operate supportive housing? We don't have those discussions, and it's time we did.
You have a question?
Yeah, a few minutes ago, Rob listed off a number of accomplishments and initiatives the housing authority is doing, and it all sounded great. And I'm sure that if we went through the leaders of these 18 organizations, or 18 pages of organizations came in, they'd also have a list of accomplishments and initiatives, and it all sounds great. But nobody seems to be happy with the totality of the outcomes.
I would question the assumption you just made, but ask the
Okay.
question.
All right, I don't think anybody's happy with the outcomes. Let's just leave it at that.
Right.
I guess my question is, because I'm sitting here struggling, the answer to this is what is the specific overarching goal of all this activity? What are you trying to accomplish? It's not clear to me.
Good question.
Two things really quickly. I'm going to come at it from a backwards end. We want to get people off the streets and keep them off the streets. That's the quick answer. Okay. We don't want people to end up on the streets that currently aren't on the streets. So it's, you know, it's basically keep people housed and as healthy as they can be. Even this data that you have in front of you, we can't even say this is generated by, with the support of a lot of different people,
there are people on this list who are dissatisfied with what they're able or not able to do. So that was the part I was going to suggest we question, is even some of the providers, yeah, sure, they can list what they do really well, but they're really frustrated. And that's where I think we have the opportunity for change. Because the people that are really invested in this want to approach that question of getting people, either preventing them from getting on the streets or being on the streets and getting them into housing. They can't, they're so tired of these little pockets moving like this and not really being able to create an impact. One of the data things on this is it unduplicated clients or was it bed nights? It doesn't even say. So how do we even analyze some of the data that we have? And so they're frustrated also between and amongst themselves. If they're trying to create a culture of collaboration and cooperation, if someone approaches, say, Mike Foley at Casa Esperanza, are they thinking about what could Sam bring to bear if they work together collectively on that, and then there's a county-wide approach? And that's sort of kind of the dialogue, and it's a good thing. You know, Sylvia Bernard and Mike Foley are in constant dialogue together. It's a classic example of it's not just about CASA. It's not just about Good Samaritan. It's about how they're going to do and create a culture of decision making and doing things differently.
And I think it's about a system.
Yeah.
So we have different entities and we each do our own thing according to our own criteria and our own funding. But do we have an integrated system? Whether you're the same agency or not, it's how you work together. And I think that's part of what we're working towards.
I would take a different view from both of you, because I think it's about specific, actionable, measurable outcomes.
Yes.
And I'm not hearing that anywhere. In other words, people off the street or more people off the street, it sounds right and in direction it's right, but it's not specific. And it seems to me that it's great to have a lot of process, it's great to have a lot of collaboration, but you got to know where you're going.
That's right.
And exactly what you want to accomplish. And I read this presentation already, and I didn't see that anywhere, and I haven't heard it today. And you might want to start there with big, measurable, where we want to go sort of stuff, and then figure out, or fit in the process afterwards. It sounds like the process is coming first, and the outcomes are coming second to me.
We threw that big thing up on the wall just Monday with the coordination committee preliminary meeting saying this group is going to be responsible for creating that target that everybody knows what it is. And there's got to be, and I said specifically there's got to be one or two that everybody can get behind, and then the goals to meet that have to be diverse to get to that one or two targets. But that did get set.
So that's coming, is that what you're saying?
Yes.
It has not been.
It has to be done. Yeah, I couldn't agree with you more. It's not an option.
That's probably has a lot to do with the frustration on these individual levels.
Absolutely.
None of them, they're chasing a very gray area.
That's right. And the people who are doing a lot of work, they're in the trenches, they're in the weeds. If they're not collectively trying to understand what the aim is, that's part of why we need to make sure we have some system consistency with some data.
Very good outcomes.
I was going to suggest that to deal with some of the barriers you discussed, that has anyone talked about approaching those caps to get federal waivers to cut through some of these laws? I mean, a lot of that went on in the healthcare arena, okay? Is done where there were local problems, and essentially, basically, some of the progressive Congress people went in, and said, for my district, for my county, I would like to be able to get federal waivers to combine funds to do these things. The example you gave of different coverage or treatment periods. Agencies can give waivers. It's one of the things, certainly, at least while we have a Democratic administration for at least part of another year, we should look at and not put it on the back burner. This may be one of those opportunities where we could get some waivers for 3 years to cut across some of these things, and if we're getting our act together locally.
So Fred, that's an example of the kind of thing that we envision coming to or coming out of the coordination committee to the leadership council to be able to try to impact policy.
So that, to me, the way I hear your question framed is, how can we bring to bear the various entities in the system to advocate for what we think are the right approaches? And that's at a level that it's not, we don't know what outcome we're aiming for, we don't want to be doing, and there's a ton of really smart people who know how to use their systems. It's a matter of, they're doing it over here and over here, and we've got to bring it there.
I think one of the ways when you have these types of large policy structures, and in my 2 years in the federal government, I spent half the week, attending things like these, is to have specific, actionable problems to tackle.